Hi, this is Eileen with Bega, and I'm focusing on my little visual aid there. I'm trying to do this in such a way so I can use a visual aid, but if I just have the camera pointed at me, it's mirror, and my husband's all upset about that, which I understand, but I don't have a camera crew, so I'm doing the best I can. So, today I'm going to talk about, and I have my computer going over here too so I can keep track of all my notes. So. We're making this up as we go along because I'm not technically skilled, but here we go. All right, like I said, I'm Eileen, and I have a little company called Bega. Biggie Gives Advice, which is occupational therapy. And today I want to talk about why it's important to, for people in nursing homes especially, to use the toilet regularly instead of just being put in a diaper. And even though a diaper is so convenient and you need less staff, and the reason I'm talking about this is because I come across this all the time. Occupational therapy writes goals for people to be able to use the toilet more independently or easier. And the reason we do that is because many of them are going to go home and have to do it themselves, or their caregivers are going to have to help them, or they live in a facility and someone's going to help them, and it needs to be as easy as possible. And what I find when I go out there to work with these people is they're all bundled up, all nice and tight in a diaper, and just not using the bathroom. They're taken sporadically depending on who's working and how motivated they are. Maybe they get taken to the bathroom twice. Maybe when they ask, they get taken. Some people do, but most don't. And this is a very detrimental, and it leads one to question, why do we put them on toileting goals if we're not going to do it? So I'm going to talk about why, the reasons empirically why it's important to use the toilet. A common thing I hear a lot that my patients tell me is that such and such staff person told me that if I wear a diaper that I can pee in it 3 times before they have to help me, and they're really busy. And I don't know where they get the 3 times, but that's a very consistent statistic that they tell me. So a lot of my patients, they'll buy into this because they're really sweet and they want to be helpful, and they think that this is the rule of a nursing home, is to wear a diaper, so they just go along. A lot of other ones, they don't buy into this. They fight, and they want to retain their dignity and use a toilet, and it's just a sad thing to watch, because really when you are put in a place like that and you go there because the premise is that you have help to do the things that you need. So anyway, back to this and why it's important, even though a diaper is so convenient. All right, the first one is retention. When a person has to go to the bathroom and they have to wait, they do their best to hold it. And once in a while, if you're just trying to get to the end of a movie or something, that's no problem. But if you do it consistently, it can lead to constipation and impaction, which is extremely painful, and also you can die from it. I have had some people in places that I've worked literally die from this, and it's a very painful, not good way to go. Another thing is that bacteria builds up inside, either in your bladder or your bowels, and leads to infections. In some cases, a full bladder or bowel can burst, and a person can die from that. It's not common, but it can happen. But overall, one of the biggest things that happens is the bladder and the bowel, they'll lose the sensory ability to know when they have to empty. And over time, you lose this ability to know when you have to go, you just become incontinent. So by making people wait, not taking them to the bathroom when they know they have to go and they can go, you literally create the condition of incontinence. Well, and what's wrong with that? Well, now that you've lost this sensory ability and you are incontinent, now you go and you sit in it. And what's wrong with that? Well, so many things. Well, I wrote here that it says that some estimates say 30 to 70% of nursing home residents are incontinent. And I think that's really sad to say, because my question then would be, how many were incontinent when they got there? How many are incontinent organically because something happened in their body? And how many have we made incontinent by making them hold it and not taking them to the bathroom? So the problem with the diaper, as we said, is they sit there wet. And I read a statistic says that a nursing expert says a person in a diaper should be changed 5 to 8 times a day to be safe and protect their skin. Well, a lot of times one CNA can have up to 13 patients. So it's virtually impossible to take them 5 to 8 times a day. Also, from personal experience, if they get changed twice a shift, that's really, really good. And so if they're sitting there wet or soiled, what does that lead to? Skin breakdown. This can be something kind of simple like a bacterial or yeast infection. Experts say 41% of nursing home residents have some type of perineal skin damage, such as diaper rash, that type of thing. But more importantly and bigger, the same people also say that when a person is consistently wet or soiled from incontinence, they're 22 times more likely to develop a pressure ulcer, which is a bed sore. And a pressure ulcer is very, very painful, very difficult to clear up, can take years, sometimes they never do, and they make it difficult to even sit in a wheelchair and live your life. Just a miserable, horrible, mostly preventable thing. All right, another thing is infections, urinary tract infections. When you're sitting there and you're wet or soiled, you're having all kinds of contact with the bacteria that's in the urine or the feces. You're also holding it in the bladder. First of all, a UTI can become systemic and a person can literally die from it. UTI will cause mental changes, dementia-like symptoms, which leads to other injuries such as falling. They say up to 70% of falls are related to the bathroom in some way. Either the person's trying to go and they fall, they have an accident and they slip in it. But I think it's probably even higher than that, because a lot of people that fall can't tell us why they fell. All right, another one, cost. Now this is not the biggest on my list, but it is very important because all the money we spend on these things could be going to have better care for our folks. I read a statistic that treatment and hospitalization for a UTI can cost up to $2.8 billion a year in this country, and this is not any of the costs that's associated with, say, a hip fracture or head injury that comes because you're confused from the UTI. So none of that stuff counts. For bed sores, treatment and hospitalization for a bed sore can cost up to $11 to $13 billion a year. That's a lot of money. And I'm throwing out there that most CNAs that work in nursing homes make between $11 to $13 an hour. So if you had some more of these folks around and they were trained better to take people to the bathroom more often and given a reasonable caseload so they could, you wonder how many of these billions of dollars could they save that could go to pay for them. So basically what I'm saying is they pay for themselves and everybody is more happy. All right. Another thing is overregulations. Now, back in the day when I started this, back in the early 1990s, everybody I worked knew what OBRA was because it revolutionized nursing homes, and it's basically the reason therapy is even in a nursing home. And what it says in a nutshell is that just because a person lives in a nursing home doesn't mean it's okay for them to lose function. That the job and the obligation of a nursing home is to keep the person functioning at their highest level. So if a person moves into a nursing home and they are able to go to the bathroom with some help as determined by somebody designated to make that determination, such as a therapist, which is why we're there, then the nursing home is obligated to have the staff, have the situation, have the grab bars, whatever it is, to take that person to the bathroom. It does this regulation doesn't just apply to toileting, but that's what we're talking about. So if I go and I treat Mary and I go, Mary is able to use a toilet with minimal assistance, and you'll need to take her every 2 hours because she forgets to ask, that by these regulations, the nursing home is obligated to do that. Now, I'm not really sure what happened over the last few years that this doesn't happen. And this seems to me to have disappeared off the priority list of nursing homes, because years ago, if any staff person told a resident or patient, you know, Mary, if you use this diaper, I don't have to take you for whatever, that was a fireable offense. People were not allowed to do that. If a CNA said that or anybody said that, there'd be holy hell raining down on their head. So, but somewhere along the line that disappeared because diaper is the name of the game today. So basically, when you do put a brief on a person, just for the sole sake of convenience, you're pretty much skating around the law. That's the obligation of the nursing home to take you. All right, now I put this at 7, but to me, this is really pretty much the most important thing. The mental effects. If you're made to go in a diaper when you can use the toilet, what does that do to you? How does it feel? I mean, holding your bladder, holding your bowels is a miserable physical feeling. It's miserable. And having to hold it so long until you soil yourself and then sitting there soil, it's dehumanizing. I made a list here. Loss of dignity, decreased self-worth, embarrassment, depression. You don't want to go and do anything. Your quality of life is, to make a pun, kind of in the toilet. So really, when you think about it, to me, this is the most important. I don't want to live like that, being made to soil in my pants, and I'm sure they're not either. So anyway, I think I made a pretty good case of why it's important to take a person to the bathroom rather than bundle them all up in a diaper and let them use that. It's sort of a class in a way that I think shouldn't have to be given, because I think we all kind of get it. Nevertheless, here it is. So anyway, I appreciate you listening and being patient with my complete lack of technical skills, but I appreciate you taking the time to listen to me.